This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA, PRA, Category 1 credits. This is accessible through our online course modules that can be accessed at www.emergencymedicalminute.org/CME-courses, or simply by clicking on the link in our show notes and creating an account.
All right. Well, good morning, everybody, for who's here. So we have, decisions to make after we have someone who comes back from cardiac arrest and they get return of spontaneous circulation. And one of the decisions we have to make in treatment is if they're still hypotensive, which is frequently the case, do we start them on which pressor? So usually we would either use Norepinephrine, which we commonly use here, or sometimes we use Epinephrine. And, there hasn't been a lot of good studies to show which one might be better, Norepinephrine or Epinephrine, in someone who's still hypotensive after cardiac arrest. But there was a recent study that had some pretty dramatic results. And the trial was done in France, and it was about almost 800 patients. It wasn't randomized. It kind of observed patients to see whether they were on epinephrine or norepinephrine and who did better. So there's potential for bias. It's not controlled as to who got what, but they did try to kind of match the patients. And overall, the results were very favorable for norepinephrine. Epinephrine actually looked pretty bad. So specifically, death from shock was 35% for epinephrine versus 9% for norepinephrine. So pretty dramatic there. Recurrent cardiac arrest was 9% versus 3% favoring norepinephrine again. And then a couple other comparisons that were much better for norepinephrine. All-cause mortality during the hospital stay was 2.5 times higher for epinephrine. Cardiovascular specific mortality was 5 times higher for epinephrine. And then overall, the frequency of unfavorable neurologic outcomes, one of the things we care about the most after cardiac arrest, who's going to have a good neurologic outcome, was again much worse for epinephrine, 3 times worse. So while this isn't definitive because they didn't randomize the patients and hopefully there will be a bigger trial, this is kind of the best data that we seem to have at this point, and definitely seems like if you have to put someone on a pressor after cardiac arrest, norepinephrine is probably a better choice to start with. So any questions, comments? All right, thanks everybody.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.